Good evening, everyone. I suppose everyone can hear me. So let me introduce myself. I'm Nemanja Ristić, coming from Serbia, and this is the 6th of the EuroFusion webinar organized by Serbia. And together with two of my colleagues, we will represent our country in the best way. So we will talk about the perfusion in 3 sessions. One will be about the history, and the second will be about the situation, what is it like now. And the third one will be about future plans for the perfusions, clinics, and hospitals. So I will introduce my first colleague who will talk about the history of perfusion in Serbia. His name is Aleksandar Masić, and because we are in one place, we'll change each other's places, so because of the microphone. So he'll start the presentation. Good evening once more, and
hello everyone once again. Nemanja, thank you for introductions. As he said, my name is Aleksandar Masić. I've been working as a perfusionist for almost 3 years now. I have to say it's my pleasure to be a part of EuroFusion webinar. We will start this presentation with a brief introduction of our beautiful country. Serbia is a landlocked country in Southeast Europe at the crossborders of Pannonian Plain in the Balkans. We share borders with Hungary to the north, Romania to the northeast, Bulgaria to southeast, North Macedonia and Albania to the south, Croatia and Bosnia and Herzegovina to the west, and Montenegro to the southwest. Serbia has about 8.6 million inhabitants. Our capital is Belgrade, which is also the largest city. Official language is Serbian, national drink is rakia, and our national food is sarma. There are 8 cardio-surgical centers in Serbia, which of 6 are located in Belgrade. ICVD DEDIDNJE, Institute for Maternal and Child's Health, Dr. Vukan Čupić, Clinical Center of Serbia, University's Child's Clinic in TIRŠOVA, Military Medical Academy, and Euromedic, our only private cardiosurgical center. There are also 2 clinics outside Belgrade, which are Clinic for Cardiac Surgery UCC in Niš and Institute for Cardiovascular Diseases Vojvodina in SrbSecta Kamenica. Now I will go chronologically over each of our centers. We will start off this presentation with University Children's Clinic TIRŠOVA, which was opened back in 1922. Year of the first perfusion was in 1998. In the first few years, there were 2 perfusionists that worked in one operating room. Few names well known in cardiac surgery in the world are Professor Kalangos and Dr. Kostolny. They visited TIRŠOVA a few years ago. Next one is Institute for Maternal and Child's Health, Dr. Vukan Čupić, that was opened back in 1950s. In the first few years, they had 1 to 2 perfusionists and worked in one operating rooms. In 1979 to 1981, 67 children with heart diseases were operated on, but without use of extracorporeal circulation machine. On February 2nd, 1982, the first open heart surgery was performed using extracorporeal blood flow device. On your right, you can see the image from that operation that was performed by Dr. Ivo Popović-Đani. In the period of 1983 to 1991, Institute for Maternal and Child's Health, Dr. Vukan Čupić, was a center for whole Yugoslavia, and each child was operated in that center. Next one is Institute for Cardiovascular Diseases Vojvodina in Sremska Kamenica. It was opened in 1960s. First few years, they had 3 perfusionists that worked in 3 operating rooms. First heart surgery was performed in 1965. The first hypothermic operation, which was VSD closure, was in 1969. And the first operation with extracorporeal blood flow was performed back in 1970s, replacement of aortic valve. 2 of the names of professors that visited the Institute for Cardiovascular Diseases in Vojvodina were Professor Kalangos and Professor Kaifer. On your left, you can see the image of equipment they used back in a few years after opening, and on the right, it's an image of equipment they use today. Next one is Clinical Center of Serbia that was opened back in 1963. In the same year, first operation with extracorporeal blood flow was performed on. In the first few years, they had 4 perfusionists that worked in 3 operating rooms. Few big dates for this clinic are 12th of June 1967, when Michael Debicki performed 2 operations. In 2013, they implanted the first heartmate. On 12th June 2013, first ECMO in Serbia was implanted also in this clinic. And on 12th September 2013, transplant program in Serbia started, and they performed 52 transplantations up to date. Next one is DEDIDNJE, Institute for Cardiovascular Diseases DEDIDNJE, that was opened back in 1977. There worked 4 perfusionists in the first few years on 2 operating rooms. In 1978, the first cardiac surgery procedure, triple coronary artery bypass grafting, was done. And up to date, we performed 55,000 open heart surgeries. In 1995, the first heart transplant was performed. It was led by a team of experts led by Professor Rejk Huškić, Dr. Duško Nežić, and Professor Dr. Miodrag Perić. In 1997, the first LVAD was implanted. It was XY Toratec. This year, 2022, DEDIDNJE 2 was opened, which increased our capacity by double. And we currently hold a record for 21 operations in one day. That was on the 15th of March this year. On left, you can see a picture of our institute, and on right, this is actually the picture I took just a few days ago when we had one operation. You can see all the equipment we are using nowadays. Next one is a clinic for cardiac surgery, UCC in Niš, which is our youngest clinic. It was opened in 2014, the same year the first perfusion happened. There worked only 1 perfusionist in 2 operating rooms. Now I will talk about SrbSect, our organization. It was founded in 2006. In 2016, we got a visit from EBCP. They came to Belgrade, visited our sites, our hospitals that we work in, and there is actually in Hospital TIRŠOVA video library of that whole visit. From 2016, we are member of the European Board of Perfusionists. And that year we got a grandfather clause that was implanted on every perfusionist that worked for 2 years at least in our country. And for school, it was decided that Institute DEDIDNJE and University Children's Clinic TIRŠOVA were bases for next perfusionists. Thank you very much for your attention. I would like to give word back to Nemanja Ristic, who will talk more about quality of perfusion nowadays. Thank you very much once again.
Well, good evening to everyone. Second time, we should go on the second presentation, which will perform by me. Yeah, I think everyone can see it. So I will talk about the quality of perfusion nowadays. As I was introduced, I'm Nemanja Ristic, EBCP delegate from Serbia, and I will start talking about the cardiac centers which are located in Serbia. We have 8 of centers, which 5 of them are adult clinics, which perform about 5,000 operations or perfusions per year. We also have 2 pediatric clinics, which performed around 400 pediatric perfusions per year. One more is military clinic. It's adult clinic, and they perform about 250 adult perfusions per year. Because of the military politics, they cannot be part of our society. And on the right side, you can see the picture of Serbia and 3 red points. On the north, you can see the Institute VOJVODINA, and in the middle is the Belgrade, which had the 6 clinics. And in the south, you can see the big city Niš, which is the clinical center for South cardiosurgery. So we'll begin with the clinical center of Serbia, which is located in the Belgrade. They have 3 operating rooms and 9 perfusers. 8 of them are Europe certified perfusers, and they perform about 1,500 perfusions per year. They having LVADs program, which is about 15 LVADs per year, and also they're using ECMO and intra-aortic balloon pump support, which is about total number per year is about 10. One big information to inform you that the clinical center of Serbia is the heart transplant center. Today, from the start of the transplantation program till today, they performed about 50 transplantations, which is the 8, which is about 8 per year. And because of the COVID pandemic, the last year was not in that numbers, but we'll try to reach it again. So next is Cardiovascular Institute Vojvodina. It's located in Sremska Kamenica, which is on the north of our country. They have 3 operating rooms and 7 perfusers, which all of them are Europe certified perfusers. They perform about 1,000 perfusions per year. Also, they having LVAD programs, which is the number of total LVADs per year is about 3. And they're using also ECMOs and intra-aortic balloon pump support. Total number of ECMOs is about 13 per year, and intra-aortic balloon pumps are about 10. On the right side up, you can see the picture of Institute Vojvodina, and the picture on the down, you can see our colleagues with their machines, picture in the operating room. So we'll go to the next slide. Here's the clinic from where I come. It's a Cardiovascular Institute DEDIDNJE. It's located in Belgrade. And as my colleague Alexander Masic already said, is the clinic that had a reopening of new building in this year. So we double our capacities. We now have 7 operating rooms in which work 14 of perfusers. 8 of us have Europe certified license, and we perform about 2,000 perfusions per year. We're also using ECMOs and in-aortic balloon pump support. Total number of ECMOs per year is about 20, and intra-aortic balloon pumps are about 40. So we also have a LVAD program. We have 5 LVADs per year, and we are very proud of many invasive procedures and hybrid procedures that we've done. Also, I wanted to say that the Cardiovascular Institute of DEDIDNJE is the top center, and I'm proud that we've done most of the total artificial hearts in this year. Till now, we have done it 9, and in this year, the number is 5. Next clinic is Clinical Center of Niš, which is located on the south of our country in the Niš, and they have 2 operating rooms, 4 perfusers, and one of them is Europe certified perfuser. They performed about 300 perfusions per year. Also, they having a LVAD program, which is not that much, but in their capacity, it's a very big number. And they're performing ECMO and intra-aortic balloon pump support. The numbers of ECMO are 3 per year, and intra-aortic balloon pump is about 5 per year. Last open clinic was a private clinic called Euromedic Hospital, which is located also in Belgrade. It was opened in July 2021. They have 1 operating room and only 1 perfuser, which is European certified perfusers. They done about 50 perfusions till now. When we're talking about the pediatric clinics, I'm very proud of those 2 clinics because they are educational center for all of us. And the first clinic I will talk about is the University Children's Clinic TIRŠOVA, which is located in Belgrade. They have 1 operating rooms and 3 perfusers, which all of them are European certified perfusers. They perform about 240 perfusions per year. And also they're using ECMO supports, which total number per year is about 1. So as I already said, they are educational center for every perfusionist from Serbia. When we're talking about the second pediatric clinic, it's called Modern Child Healthcare Institute, Dr. Vukan Čupić. That is a pediatric clinic located in Belgrade, which have 1 operating room. They have 3 perfusers, and all the 3 of them are Europe certified perfusers. They perform about 130 perfusions per year. And also they are the 2nd education center in Serbia. When we're talking about SrbSect, this non-profitable organization which members are perfusionists, we have about 41 members, and 33 of them are Europe certified perfusionists. We have 4 honored members, and those are our colleagues which were perfusionists, and now they work in some of the industry, but they don't have a chance to vote on meetings. Also, we're having about one board meeting per year. Last meeting was on the 19th of March, and it was also the election meeting. As a new SrbSect chairman, it was voted, it's ACCP Slavko Kulic, and the new EBCP delegate, which was me. When we're talking about the vision of the SrbSect, the vision is the same till from the opening the SrbSect. Is the recognition of the profession and making academy perfusion school, also a separation of perfusers in pay grades. On the right side, you can see the picture from our last meeting in Hotel Putnik, and that's it for this slide. Now we can go to the next one. When we're talking about the education and ABCP school, we're talking about the job of perfusionist, which is the, like in the most of other countries, job on learning. And also we're having a clinical transaction between our clinics. The colleagues from pediatric clinics go to the adults, and also the colleagues from the adults go to pediatric clinics. Perfusionist is the man or woman who have 2 years of standalone work and 100 standalone procedures. So also when we're talking about educations, we have our forums, which are performed about 2 times per year. Also, the Medtronic started their forums for perfusionists, and some people from the society get a chance to introduce themselves and presented some teams on that forums. The plan is to have them 4 times a week, 4 times a year, sorry. When we're talking about ABCP school, in 2021, we had only 1 candidate. In 2022, we don't have no candidates. And in 2023, we have 2 possible candidates from our country. We're going on conclusions about these talks. All clinics are working with the ABCP guidelines, and all clinics are using blood cardioplegia, centrifugal pumps, except of pediatric clinics. Everyone are using blood monitoring. Most of the clinics are using ECMO, Cell Saver, and ELVOD program. And all the other techniques and technology which is recognized as good for perfusionists. When we're talking about next presentation, it will present it Branko Krsmanovic from Clinical CENTARS Serbia. The name of the presentation is Future Developments of Perfusion Technology and Academic Education of Perfusionists. So thank you very much once upon a time, and Branko will introduce himself.
Good evening, everyone. Thank you, Nemanja, and I wish to welcome you for this webinar. I am a perfusionist on the University Clinical Center of Serbia and the Clinic for Cardiac Surgery. And tonight I'm going to present you aimings of our society and perfusionists in Serbia with future developments of perfusion and technology, and our aimings for academic education of perfusionists. As a perfusionist being trained abroad, first perfusionists being trained abroad and trained there, every new colleague coming to cardiac clinics. Programs in educations of perfusionists were very different from the clinic to the clinic. After founding SrbSect organization, those programs got more coherent, and every perfusionist got more equal education. After Serbian Society of Extracorporeal Circulation got recognized as full member of European Board of Cardiovascular Perfusion and having their first perfusionist accredited licensed by grandfather clause, we form our department of EBCP school, and our fellow perfusionists got their first generation of perfusionists who completely got equal education in their clinics. Growing professionally in the career from the toddler perfusionist, I had chance to learn from my colleagues' stories that how our job was very different, not so far in the past. My first assignments as a toddler in this profession were to cut tubings, connect them with connectors, and prepare them for sterilizations for table and the pump pack. Speaking about these simple things like tubings, we could witness rapid development of perfusion and cardiac surgery, from getting pre-prepared and sterilized packs to starting using in-blind monitoring, cardioplegia, blood cardioplegia, and minimal invasive procedures, ECMO procedures, and heart transplant. From working abroad in humanitarian organizations like Emergency, private cardiac centers in Cyprus, China, and Germany, and being part of educational teams in training personnel in new cardiac centers in Serbia like Niš and Užice, and region North Macedonia, we showed our dedication to learn, improve, and pass our knowledge to others. My colleagues showed that they are not only able to learn and adopt new techniques, and that they are also very often initiators of new procedures in perfusion and cardiac surgery. We are respected members of our team inside our clinics and in cardiac surgery, but outside we are not very little bit known and not recognized outside of our organizations. In Serbia, perfusionists are not recognized and separate from the nursing profession, as most of us has some level of nursing degrees, and we are in the same pay grade as nurses in operating theater. We are in constant communication with relevant institutions and government bodies about professional recognition, labor unions, Ministry of Health, and chairmen of our clinics. Future plans for the clinics and National Master Plan Program for Optimization of Healthcare is bringing two ways of merging two related institutions with integration of institutional and functional kind of integration. This will enable our clinics to exchange services, equipment, space, and stuff among each other. And this way of merging is going to happen in University Children's Clinic TIRŠOVA and Institute for Mother and Child Dr. Vukan Čupić, which will open these institutions of getting better healthcare in pediatrics, and especially in cardiac surgery. By same master plan, Clinic for Cardiac Surgery of University Clinical Center of Serbia will get two new hybrid ORs to perform and work together in newly built emergency center of Serbia, all showing needs for more perfusionists. Clinic for Cardiac Surgery of University Clinical Center of Serbia is the only clinic in Serbia with active heart transplant program and heart transplant center, which was, let's say, stopped during the COVID pandemic. Our aimings and goals is to reopen program of the heart transplant and get much more included in process of joining to Eurotransplant organization and getting easier access to organs we are in need for our patients. Also, Clinic for Cardiac Surgery of Clinical Center in Serbia have aiming to become national ECMO center, as we are the clinic with the biggest number of ECMO procedures. The plan is to join with other clinics, not only focusing on cardio heart support, but also on the support of patients in need for lung support. 2 new hybrid doors in newly built emergency center will enable us to start working with TAVI procedures, and adopting of 1 more OR in our new building is going to bring us in need for more perfusionists. Also, the plans are for starting with minimally invasive extracorporeal circulation systems and also BIVAS. Institute for Cardiovascular Disease, DEDIDNJE, with its own newly built building, is expanding total number of their procedures per year, and it's in need for trained perfusionists. Also, with the Clinical Center of Serbia has plans to join, has plans to get more included in activity about joining to Eurotransplant, and about recently starting programs with MIEX systems. They are already very close to start. They have trained team who completely with perfusionists who were trained in Slovenia, and Institute for Mother and Child, Dr. Vukan Čupić, has its own program of support for cardiac patients, but also planning to start with venous support. They are already having systems and planning to train perfusionists abroad. Children Clinic TIRŠOVA is also in plans of including in Eurotransplant and start transplantation program as a clinic for cardiovascular diseases niche, having ECMOs, including in transplant program as the youngest clinic in Serbia for cardiac surgery to train and educate their perfusionists. Future academic education of perfusionists. As we already know, there is no formal education for perfusionists in Serbia, and in the plans and actually finished program for education on academic level as continuous medical education on medical faculty is planned to be 1 year with 2 semesters, with general subjects in medicine and specialized subjects in perfusion techniques, technology, and science. Practical education is planned to organize in wet labs and clinics, and the plan is that this program should be post-bachelor degree program awarded with 60 European credit transfer system points. Aiming that this school should be a requirement for all future perfusionists before employment, and our wish is to one day invite European board to our school and to accredit it as official school of European board for cardiovascular perfusion. SrbSect educational forums, as we already heard, has organized 2 annual meetings with goals of sharing experience, knowledge, and keeping in touch with our colleagues. SrbSect has aspirations to organize Balkan forums. The reason for this is proximity of our countries, common language, and common problems in our region. The goal is, of course, continuous education, sharing experience, and mutual support in resolving common issues. I would use this opportunity to encourage all my colleagues to start educating themselves now on any kind of academic level, is it bachelor, master's degree, and PhD, till one day we got this school of perfusionists in Serbia. Thank you for having us today. I wish you good health, good flow, and good gas exchange. Thank you.
So if anyone of those who listen have any of the questions, feel free to ask it, post it in the chat. So the questions we have an answer right now, we will answer it, and the questions we don't have answer, we'll send it by mail after the session ends. So be free to ask everything. Thank you for all. Thank you for all best wishes and regards from every country which is following the webinar. So if there is no any questions, I will say thank you for everyone for following the webinar, and I suppose you were sorry, I didn't see we have two questions. Hi, great presentations. How you evolve the improvements in your quality? Many thanks, Sarah. Thank you. When we're talking about the improvements in the quality of the work, there's two improvements talking about getting the academic education of perfusionists. That is the new level, because in our country there is not even any education except the European license, which is not in needs for working in Serbia. So we're trying to opening our schools and get it to academic level after the nursing school. Also, we're trying using best of our practice work, going to the other countries. Some of our colleagues were in other countries and making a new experience. So that's what we talk about improvements. Now we have one more questions. What is admission criteria for overseas studies over there? When we're talking about admission criteria for students that will study the perfusion, we don't have that answer right now, because all the plans for opening the education in our future we're trying to open the we don't have the plan right now, because everything is in the negotiations, and also one of the criteria I think will be working as a perfusionist and having about 2 years of the working experience. Also, we having one criteria is about the 200 of perfusions and bachelor degrees. Thank you very much. Is there any other questions? Once upon a more, if there is any questions, feel free to ask it. When we're talking about we have one more question. Thank you for the great overview. Are perfusionists involved in organ preservation? Yes, we are involved in organ presentations for kidneys, liver, and hearts when we're talking about transplant. Yeah, one more question. What is the basic training to become a perfusionist? We're talking about 2 years of working and 200 of procedures, self-working procedures. And we have one more questions. Any chances for overseas perfusions to join perfusion schools? Yes, we are open for everyone to visit our school. Thank you. Any more questions? Well, I'm free to ask it. Feel free to. If there is no questions, others, I will want to thank you everyone for being so kind and have your attention. This is the first webinar that we organized, and I'm very proud of my team. So thank you once upon more, and goodbye. Have a good guest exchanges, and see you on the next webinar. Thank you.